Thank you all for joining me. Today is Earth Day, and I have a very Earth Day relevant topic to discuss with you. According to the National Institutes of Health, our changing climate is expected to affect our air quality in negative ways. The amount of allergens and pollutants in our air are growing as the environment gets worse. It should be no surprise then, given those consequences, that asthma rates across our state are rising, especially among our children. What's more surprising is that funding for the CDC National Asthma Control Program has actually been reduced. This is money that was meant to help schools prepare for potential asthma attacks. With 465,000 children suffering from asthma in our state, including my own son Theo, we should be investing in asthma education, prevention, and training. Between 2011 and 2013, this disease sent more than 34,000 children to the hospital for overnight stays. Asthma affects 10.4% of New York's children, and among the low-income population, it affects 14.4% of children. In New York City, an estimated 185,000 children suffer from asthma. In Western New York, the estimate is around 31,500 children. In the Rochester Finger Lakes region, it's estimated that more than 28,000 children suffer from asthma. In Central New York, it's more than 24,600 kids. In Southern Tier, 13,000 kids. Capital Region, 25,000. North Country, 11,000. Hudson Valley, 57,000. Long Island, 67,000. You can see that this is truly a statewide problem. Doctors and researchers from across the country are working to understand this disease and the specific environmental triggers that can cause attacks. In the meantime, we need to ensure that our schools, the places where our children spend so much of their time, are prepared to handle this chronic illness. Across the country, asthma causes students to miss a total of 10.5 million school days each year. This is disruptive not only to teachers and classroom aides, but to the boys and girls who have to miss their lessons and their parents or guardians who have to leave work to rush them to the doctor's office or the hospital. We need schools to be prepared and ready so that kids don't have to keep missing school, and that families can have peace of mind that their schools can properly respond to an asthma attack. My son Theo has asthma, and I know what it's like. I know what it's like to get a call from school saying your son is having trouble breathing. Our schools need to do a better job and be better prepared to deal with students who have asthma attacks. I'm introducing the School Asthma Management Plan Act to fix this problem. This bill would ensure that schools have a coordinated response to asthma-related medical emergencies, better communication with physicians, and access to life-saving medication. Under this new legislation, schools would be able to apply for grants that would give them funding to train their staffs for emergencies and purchase equipment like inhalers. All schools would be eligible to apply for these funds, and the bill gives priority to low-income schools which have a disproportionate amount of asthma cases. And we can also bolster what our local governments are doing to raise asthma readiness awareness. Another bill, the Family Asthma Act of 2015, would help us do that. It would require the Centers for Disease Control to work with state and local health departments to improve public education and awareness about asthma. I'll be urging my colleagues to pass these two bills in Congress. No issues are more important than the health and education and well-being of our kids. Thank you, and now I'm happy to take your questions.
Do we have any on-topic questions?
Yes, I do. My name is Jennifer. I'm with WNYT in Albany, New York. And Senator, when you talk about understanding and education, would this apply to school nurses who would then be able to understand and diagnose asthma as opposed to just coughing? Because I have two children with asthma, so often people misdiagnose when they're not.
Right. Right, so it would give exactly. It would give funds for school nurses. Some schools don't have a nurse on hand, so it would give training to someone who would be responsible for a sick child. You know, my own son's school didn't know anything about asthma, and in fact, when I was called last year when they said Theo was having trouble breathing, he had taken 10 hits on his inhaler. Now, if you know anything about asthma, that's an overdose because it's one puff every 4 hours, and obviously I was very worried that my son's heart was racing and that I didn't know what to do, and I took him straight to the emergency room. Someone at every school needs to be knowledgeable about how to treat an asthma attack and to make sure kids don't take 10 puffs on an inhaler in an hour, and make sure they have the medication on hand if the child has forgotten their medication. So it's training for anyone on that school facility who's going to be responsible for health and well-being.
Hi, Senator. This is Erin Billups from New York One in New York City. Forgive me if you've already answered this, but I'm just wondering how much money do you think would the grant supply, and how many schools would that impact?
So we would leave it to the schools to apply. The average amount they would receive is $25,000, which would be obviously more than enough to give training, to give resources, to have supplies on hand, to understand all students who have it. But that would be the average size of the grant. But it would be a grant program, and we would ask in the appropriations for as much funds as necessary coming out of the education bill. So it would be an important place for schools that do have a lot of asthma cases to get resources so they could buy the supplies, get the training done, and be able to help these students.
Thank you.
Do we have any other on-topic questions? Last chance for on-topic questions. Okay, do we have any off-topic questions?
Hi, this is Erin from New York One again. Just wondering if you could talk about the maternity leave bill that you have, if there's any update with that.
Yes, so we have a bill that's paid family leave, and what it would allow for is up to 12 weeks paid for any individual. Everyone would buy into it, just like we buy into Social Security, so it's an earned benefit. It would travel with you, whether you're part-time, full-time, big company, small company. And you would take the leave for any predetermined life event. So something like a new baby, or a dying parent, or an ill spouse, or a sick child who needs 24/7 care and needs your focus. Those would be qualifying events. What I've been doing over the last month is trying to find co-sponsors, talking to Democrats and Republicans across the state, around the country about the bill, and I'm optimistic that we will get bipartisan support for this bill, and I'm very hopeful that we will build support for the bill over the next year.
Do we have any other questions? Okay, thank you all.
Thank you all for being on. Take care.